have a 59-year-old male with a history of a slip and fall that presented with a chief complaint of ankle pain. These are the x-rays that were sent to me from the outpatient urgent care center. I'm only going to show you one of the x-rays. This is actually the best view to review the pathology. And I want you to tell me what is the diagnosis and how you would treat this patient. So I'm going to have you come take a look at the x-ray. This is an AP of the right ankle. I usually will start at the top of the x-ray, bring my eyes down. I tend to go medial, and I look here, and then I shoot over to the lateral side, and I look in this area. What is wrong with this patient, and how will you treat them? Well, this patient, he has a widened mortise. See how this distance from the tibia to the talus is wider than this distance from the tibial plafond to the talus. So that mortise is widened. And he has a relatively non-displaced fibula fracture, and actually in all three views of the ankle, this was relatively non-displaced. If this was the only pathology, I wouldn't have to do anything surgical. The issue is he has this widened mortise, which will then need to be fixed surgically. So I will start by putting a plate on the fibula, reducing that fracture, and many times that will then stabilize the syndesmosis, which will then neutralize and stabilize the mortise. So the answer to this question is the patient has a minimally displaced fibula fracture with a widened mortise. He will need an ORIF, or open reduction internal fixation of the fibula. At the time of surgery, I will test the mortise under fluoroscopy using a C-arm. If the mortise is stable, is closed down and doesn't open, I will stop. If the mortise is unstable, I will then place a syndesmotic device to hold that mortise in position.